Welcome back to Living 808. Spine surgery has advanced dramatically over the years with the technology surrounding minimally invasive surgical techniques. Now, we're learning more about that today. We welcome in Dr. William Beringer, Director of Neurosurgery at Castle Medical Center. Hello, thank you so much for joining us.
Good morning.
Okay, so you are a neurosurgeon. Can you tell us what is the difference between a neurosurgeon and an orthopedic surgeon?
Well, when it comes to spine, there's a tremendous amount of overlap. That's the first thing that needs to be clarified. But in neurosurgery, we tend to think about the nerves that are underlying the bones that are in your back, whereas the orthopedic spine surgeons tend to think about the bones and the structure that could hopefully be improved so that people feel less pain.
Okay, but both, I guess, work with the spine.
And both work with spine, and neurosurgeons do certain types of fusions, and orthopedic spine surgeons do certain types of decompressions of nerves. So there's a tremendous amount of overlap, and both are applicable.
Okay, when is spine surgery necessary?
So only after physical therapy, steroid injections, yoga, everything that could potentially be conservatively addressed and sorted out. Only after you have a very firm diagnosis and you know what's really causing the pain do you actually even consider doing spine surgery. Sometimes people come into my office and they have a terrible problem, like their spinal cord is being compressed. And in those situations, they need surgery. They need surgery or they're going to become paralyzed. But other times it's a workup process, and until you have a firm diagnosis on what's really causing that pain or that weakness, you don't want to be cutting on people.
There's the phrase minimally invasive spine surgery. I normally would not use those words together.
Yeah.
I mean, spine surgery to me is just so, crazy, and then to have minimally invasive, how is that possible?
Well, minimally invasive came about because conventional spine surgery was so maximally invasive and so devastating to people. Conventional back surgery where they fillet your muscles open and spread everything open to get down to your bones and then
so that's what I'm envisioning.
Yeah, it created a really bad reputation for spine surgery. And there are some needs for that once in a while that's needed. But people, they have a really hard time recovering from that type of back surgery. And it's painful. And, do these people ever go back to work? Sometimes, a lot of times, no. So for the last 15 years, they've been developing minimally invasive spine surgery techniques where we can, for example, to take out a herniated disc, we're working through smaller tissue corridors, in this case, the diameter of a dime to get to that herniated disc through a little tube. Other things, pinched nerve in the neck, you can go through something even smaller than the diameter of a dime, 16 millimeters.
So that's the size of the incision?
That's the size of the incision, and that's the working corridor that we use to get down there.
Okay, doesn't that sound a lot more doable for the patient?
Yeah, it's a whole lot easier to recover from that type of surgery. And the hurdle for recovery and getting back to work and getting back to living your active Hawaiian lifestyle is a lot lower.
Yeah. So aside from recovery, what are some of the other benefits of a minimally invasive spinal surgery?
Well, at Castle we have a dedicated team for minimally invasive spine surgery. So everybody knows where the instruments, where they are at on the operating table, how to hand the instruments, what the next step of each surgical procedure is. So that's one thing. A consistent team, a good workflow for that surgery. So that surgery is reliable, quick, and then less blood loss, less infection, smaller hole for the bugs to crawl in to cause the infection.
We're looking at some video. Tell us what we're looking at. That's incredible.
Let's see. So this is a video of minimally invasive back herniated disc surgery. So it's going to be using a tubular retractor to get down there and decompress it. And then the other one would be potentially, if we go on in this video, we'll see that there's, we can do a fusion through a minimally invasive tube too.
Okay.
And so it's all, all this tubular technology allows us to go through the muscles without actually having to split them open and de-innervate or take the nerves or damage the nerves that go to those muscles so that those muscles can survive and live and help you get back up on the surfboard or the paddleboard.
It sounds like the message here is if you're living with back pain and you've tried all of the other ways to make it better and it doesn't, perhaps seeing your doctor, asking about this type of surgery is what you should do. Do people need a referral?
They don't have to have a referral. They just, they need to come in with an MRI or a recent CAT scan so that we can look at it and have a meaningful conversation when we look at what's causing their pain.
Yeah. All right. Thank you so much,
Appreciate
Doctor.
it.
Thanks for coming in. We know how busy you guys are,
Yeah.
so we thank you for that. All right. Coming up on Living